Today we want to take time and delve a little bit and educate us as community members on how this disease can present as we come up towards March, which is the Multiple Myeloma Awareness Month. So why we are focusing on March is because during this month we try as much as possible to talk more about this disease because this disease is a disease that presents in ways that can easily be missed, and therefore people end up coming with what we call end organ damage when the disease has had a significant burden to your well-being. So multiple myeloma is it's a type of cancer that it's a type of blood cancer that comes from white blood cells, where you have an excess production of a specific white blood cell called plasma cell. And what happens is these white blood cells, because they are produced in the bone marrow, there is an excess production of them, and therefore at the end of the day other cells that are also produced in the bone marrow get affected, and they are now not able to function optimally. So sometimes when you look at who is at risk of getting this disease, it's mostly a disease of the older people. Like when you look at the median age, worldwide is about 59 years of age. However, in our country, looking at a research that was done that looked at a 10-year period of the patients we have been taking care of from Western Kenya, the age is even younger at 51 years of age. So although we have seen much younger patients, even up to 30 years of age, but the older you get, the more you are at risk of getting multiple myeloma. And then also it tends to be a little bit more common in men, just a little bit compared to females. At the same time, it seems to be more common in blacks compared, for example, to Caucasians. So we then wonder whether, as African ancestry, whether that means that we are more at risk of getting multiple myeloma. And there are other risk factors, like, for example, obesity, exposure to agents like petroleum products, and but some of these are fairly non-specific. But just more is actually just knowing that the older you get, the more at risk of you getting multiple myeloma. And therefore, if you get certain symptoms, like for example, bone pain, which is a very common presentation in multiple myeloma because this is a disease that comes from the bone marrow, then you may think, okay, maybe because of old age, or I've been then you may think because of old age I'm just having body ache here and there, or I have arthritis. So it could be multiple myeloma. So unexplained bone pain, unexplained fatigue, like you're tired all the time, without a very good explanation. You probably go and see a healthcare provider near you, and they're saying that your hemoglobin is a little bit low, with an explanation that is not very clear why your hemoglobin is low. That could also be a guide. Some individuals present with kidney problems, and that is because of a certain protein that is produced by these plasma cells that may lead to renal failure. So it is mostly just feeling tired, fatigue, and also bone pain, and also at the same time, sometimes people can come with broken bones, or rather a trivial broken or a trivial fracture, meaning that the fracture just happened because of something that was not very impactful, an impact that was not significant. So that also may explain that there's a problem with your bones. And at the back of your mind, you need to think about, oh, could this be something that is coming from the bone marrow? But more important is when you have these symptoms, of course, you visit a hospital near you, and hopefully then more investigations can be done to be able to figure out whether this is because of what we are talking today, which is multiple myeloma. As we come towards March, which is a myeloma awareness month, we are saying beyond myeloma, meaning that we want to. There's been a lot of advances in the management of multiple myeloma. There are several therapies that are now in the market, first line, second line, third line, fourth line therapies, novel therapies that have come. And this disease has now transitioned from a disease that is not curable to a disease that is very highly treatable with very good outcomes. So, but the downside is if you come when the disease is a little late, in stage 2, stage 3, then the outcomes are poorer. So that is why we are spending time during March for you and me as community members to be able to think about the possibility of this diagnosis being maybe a community member has it, or for us to be diagnosed earlier, and therefore the disease is managed earlier, and therefore better outcomes. So I want to take this opportunity to sensitize everybody to think about the possibility of this disease being amongst our community, and therefore concerted efforts to be able to diagnose it earlier, and therefore have better outcomes.